Hatim,
Ali,
when someone mentions mental health to you, what comes to your mind?
honestly speaking, when someone says mental health uh, here in Oman, the first thing that comes to your mind is Ibn Sina Hospital.
Oh, why that?
The people who have gone cuckoo. That's the
Oh,
only thing that comes to mind. Is there anything more than in mental health? Does it mean
oh,
another thing?
definitely it means a lot, man. You're missing a lot. You want to
Well,
find
educate
out?
me.
All
Yes,
right.
I want to find out.
We'll come back then. Assalamu alaikum.
Wa alaikum assalam wa rahmatullah. How are you, my brother?
I'm good. How are you doing? And welcome to Chat Away in Ummati Station. How is everybody doing? How is all our followers? Can I hear
I
you?
think,
Can I hear yes? No, I can't hear
well,
you.
you will hear them through chat.
Then do not forget to please comment and put all your questions there so we can have an answers to them. And even if you just want to say Assalamu alaikum and hi, that's fine. So,
You know, Ali, you know what I like about our show is the diversity, and we keep on inviting people who are very special and who tend to educate us in different fields.
yeah.
So I think we get to learn as well, and that's the purpose of the show. And today we have a
Definitely.
special guest. Who do we have today on the show?
Okay, let me introduce our guest for today. So, our guest for today is Dr. Hamida Al-HARTHI. Hamida Al-HARTHI has been working in mental health nursing field for more than 20 years as staff nurse. She had experience working in all subspecialty of mental health. She had witnessed most of mental health developments in Oman as an Omani nurse. She then moved to
That's
academic field from 2006, where she taught mental health nursing students. There were more than 10 cohorts which graduated under her supervision. So, let us welcome Dr. Hamida Al-Harthi.
Assalamu alaikum, Doctora.
عليكم السلام ورحمة الله
Assalamu
وبركاته.
alaikum.
عليكم
How are
السلام
you
Ali. How
today?
are Alhamdulillah Rabbil Alameen. I thank Allah for everything. And I thank you, Sheikh Hatim, for inviting me today in this show. I thank you, Ali, also to do all the job. And actually, I would like to put a word about Sheikh Hatim. Sheikh Hatim, I have known him for quite long time, and I had a chance to work with him closely in those 10 years, which you have
10
mentioned,
years.
Yes,
MashaAllah.
MashaAllah.
yeah.
I thought you were
Sheikh
talking
Hatim,
about 1 year, 1 or 2 years. 10 years,
no,
MashaAllah.
no, 10 years, yes, I can say that because Sheikh Hatim
MashaAllah.
actually, we used to consider him as the source of inspiration to our students, to us ourselves, to our audience.
Jazakallah. Jazakallah.
I can say that in these 10 years, we have conducted, a huge event. Each year we had like a different theme and different topic, and that was like a project which students have supposed to do for their graduation. So we used to call in that event like 400 to 500 people, and Sheikh Hatim was one of the most wanted, guest speaker because
MashaAllah.
most of the people they used even to ask because whenever we used to call him this
Uh-huh.
year, the coming year when we used to call the audience, they used to ask us, "Is that Sheikh coming?" And we used to say, "Yeah, he's coming." So okay, I'm going to register. So, mashallah, we have learned a lot from you, Sheikh Hatim. Would like to thank you, and our students have learned
Jazakallah khair.
really a lot from you. And I think some of them they have even followed your path, even. So,
MashaAllah.
in those 10 years, we
Jazakallah
have
khair.
done,
Jazakallah khair.
You
we
you
have
you're
done a
look
great
you
job.
you're looking at one of them. You're looking at one of them, one of the
Oh,
followers.
mashallah. So I'm right with whatever I'm saying, yeah.
Subhanallah. You know, Ali, let me tell you a funny story. One day,
Yeah.
the institution that Dr. Hamida is working invited me for a talk. I don't know if you remember this, Dr. Hamida, but it was a
Mm.
graduation for midwives.
Yeah.
Uh, and they asked me to say something in this graduation. And
Uh-huh.
I had no idea what to talk about for a graduation of midwives because I'm not a woman. I never gave birth and I don't assist women to give birth. So it was a very challenging talk that I had, but it is one of the best talks that I ever had in front of an audience because the night before I went to my wife and I called up my sisters and I asked them a strange question. And I asked them, how does it feel to deliver a baby? And they looked at me like, what, what sort of question is this?
Mm.
And then we chat for some time and I got some information what it feels like to give a baby. And that was the topic of my speech for the graduation ceremony. So thank you very much, Dr. Hamida, to invite me uh, throughout the past 10 years. And we're honored to have you today. But today is not about me, it's about you and mental health. So I'm sure we hear this terminology a lot when
Yeah.
it comes to mental health. We hear mental health, and
Mm-hmm.
there are a lot of people propagating mental health now. But
Mm.
I'm sure there is a misconception in the society when it comes to mental health. So tell us your journey from the beginning. How did you get into this field in the beginning as a nurse?
Oh.
Why did you choose mental
Um,
health?
before you answer that question, let me just
Mm-hmm.
clarify one thing to one of our viewers here. His name is
Yeah.
Bilal Al Afriqi. He says, Assalamu alaikum wa rahmatullahi wa barakatuh. Brothers, please be careful of the language you use. Calling people who are mentally ill cuckoo is not funny to them. I just want to tell to brother Bilal, thank you for that. But we were
Yes,
actually
thank you.
doing an act at almost all in our shows. At the beginning, we do some kind of an act. So the act was not really done, or that word that Hatim used, cuckoo, was not said by Hatim himself, but he was acting what other people were saying. So
Yes.
yeah, we're aware of that.
But
But thank you for telling us
But
that.
we do apologize. We do apologize. We didn't mean to insult anyone. It's just it's part of the act, and inshallah, we'll not do it
Yeah.
again. Don't we? Inshallah.
So go ahead,
Yes,
Dr.
Dr.
Hamida.
Ahmed.
Okay, so if I have to say about my journey, into mental health, actually it's a strange journey because that was not my favor at all. So when I graduated in nursing, that time, I was too young and, I was so enthusiastic. I wanted to work somewhere where there is, I can see the traumas and I can handle a lot of tasks and I can do a lot of things. Then I joined Hola Hospital. Uh, Alhamdulillah, that place I worked as, in ER, and then I worked in a main operation theater. I worked in with the children also. But later on, I came to know that emotionally I'm too fragile to handle seeing people dying, especially my patients. So literally it was like every day whenever a patient dies, I go home and cry. So
Mm.
Subhanallah.
I thought, yeah, I found myself that I'm really not suitable to work in a trauma hospital. And I tried to think, and where am I going? Because what am I doing? Because I'm not doing any good to my patients if I'm going to be emotionally hooked with their diseases. And, if I see death, then, I'm not myself and I cannot handle that. Then I thought like, no, I have to change my profession. Later on, I started thinking about going to Ibn Sina. I chose Ibn Sina. You have mentioned Ibn Sina Hospital. Ibn Sina Hospital is the
Yes.
hospital which was open at that time for psychiatric patients, and it was
Mm.
located near to my house. So I thought, like, as a young mom, and let me move to this hospital. But my passion was not at all mental health. Then I said, okay, let me give it a try and see how it goes. When I moved to Ibn Sina Hospital, believe me, within the first year only, I fall in love with the mental health. I
Mm.
really found myself there. I found myself that I can do more than what I was expecting to do. Because, seeing mentally ill patients and helping them, seeing the way they come they are totally out of reality, disoriented. They don't know where they are. They don't know what they are doing and things. How we deal with them and how we treat them, and later on when they come out of the hospital, how they are. That was an amazing job. I thought, no, this is what I want really, and this is what I want to do. And since then, I'm really in love with mental health. So I was one of the nurses, few nurses which were working at that time in Ibn Sina Hospital, because at that particular time, mental health was really stigmatized here in Oman, and people were, Omani people were not having at all awareness about mental health. They were not believing that, there is, a doctor which could help people who are having mentally ill, issues, because to them, they were believing that, their patient or their loved one, they are possessed by jinn. So they used to take their people to the black magician or whatever it is. And then until the patient is halas already at the late stage, then that time they will realize, no, they have to take him to Ibn Sina. So the profession itself, it was stigmatized, but later on, with the mental health awareness, and a lot of developments happen in the country, and then we were able to change this misconception of the people about mental health. Yeah. So this is, in simple, was my journey in mental health.
So I think when people used to hear Ibn Sina
Yeah.
here in Oman, always that it comes in their mind, the type of people who are there, and then they try to be all protective even to visit that place. So maybe if you can tell us a little bit about the mental health issues in Omani community, and also, but before you do that, let us maybe if you can talk about the reactions of the Omanis who has been there in Ibn Sina, as opposed to those who haven't been there. And I'm talking about the visitors mainly, not the sick ones.
As I mentioned, the profession itself, it was stigmatized by both community and the patients and the professions. Okay, so as I said, mental health is the same anywhere in the world. A patient who is having schizophrenia is the same patient who will be having schizophrenia somewhere else. The symptoms will be the same, but it's the way the people in the community, how they understand that and how they take it. There. So here in Oman, I can say, most of the people, most of, misconception was like, these people, they are not having real disease. It's a possession by the jinn. So they used to go to the black magician, and they used to do a lot of things, which was not really related to the mental health as a something that people could seek help, or they could have take to take medicine, or to be admitted in the hospital. So that was like if someone is admitted in the hospital, believe me, sometimes they will say no one even will come and visit their patient, because they were afraid that they will be stigmatized if the community will come to know that they have one of their patients in the hospital. So it went on for quite long time until maybe I can say early 2000. That is the time that mental health was able to find their way, and people were talking very much about the mental health development, and then what is the what mental illness is, what are the help, where to seek help, and then people they realized later that there is a hospital, and there is a profession that's called mental health or mental health services in Oman. But it was a stigma. It was like I can say, compared to other hospitals, the visitors were very minimal. Okay, people were coming if a family has a mental ill patient, they used to hide them. Especially if it is a female patient, so they used to hide them. They were not even talking to the neighbors if they have like a problem or any member who is having mental ill at home, to avoid stigma.
But when did this awareness happen? When in Oman? I'm talking about Oman. Was
Yeah,
it just recently or a long time ago?
No, maybe early 20s. So it was like before 1990s. there were still like misconception of what mental health, because that time it was only Ibn Sina hospital running mental health services for the whole Oman, and we were having, I think Salala, they were having just a small ward which they used to admit mental ill patients. So the majority of patients used to come to Ibn Sina hospital, and actually it was a small hospital. The bed capacity was like 80 beds, because again, what I said, families, they were not, they were not having that insight that, there is the mental health services that could help their people. So most of the time they used to keep their patients at home. Sometimes they chain them. Sometimes, they take to this black magician. Okay, keep him inside. Don't let him go outside. So most of the time they were dealing with their mentally ill people at home rather than bringing them to the hospital. But as I mentioned, when we started, working into Ibn Sina Hospital, even Omani nurses were not even, their family were not even allowing the nurses to come and work in the hospital. So, but later on, they started changing that misconception. Many Omani nurses started joining the hospital, and then we started, conducting like awareness, going to public, going to the community to talk about mental health. So that is the time that people they come to realize that there is a mental health services that could help their people. And majority of people, they started bringing their patient. Even we were even running out of beds when they realized that there is somewhere where they can seek help. Yeah.
Dr. Hamida, when it comes to mental health, there are people who are born with issues with mental health, and there are people who live normal lives and then suddenly, out of stress or other issues, they develop mental health. In terms of Oman and the region, what are the common types of mental health illnesses that people go through?
Well, as schizophrenia and most of psychotic disorders, actually, I have witnessed in the hospital, are because sometimes there is the literature say that if a mother and a father are psychotic, there is a big chance that the children could get any psychotic illnesses like a schizophrenia or bipolar or any other psychotic illnesses. So Oman is one of the countries that we have that close relative marriage. So sometimes
Yes.
if there is a family member who is like a schizophrenia, they tend, okay, let her get married to her cousin, okay, and she will be fine. So that was the misconception that if there is someone who is ill, maybe the marriage will cure him, and who is the closest person is the cousin. Okay, so they used to let people get married regardless of their illness. So most of the time you'll find that their children, there is a big chance that their children will develop psychiatric illnesses. So psychosis and psychiatric, this one, yeah, psychosis were the most common illnesses which were witnessed. I have witnessed in the hospital. All the schizophrenia and the types of schizophrenia, it's really very, very common. And even some of the people, because it's starting in the early age, the prognosis was very, very poor. Okay, even children, I have noticed children who have schizophrenia. Again, maybe if you read their profile, you'll find that the father or the mother was suffering from either psychotic illnesses beforehand.
Can you tell us some of the experiences that you've gone through with patients? I don't know if you can tell us even stories.
Yeah. I have witnessed a lot of stories, and because literally, I have worked in each and every department in Ibn Sina Hospital. I have worked with adults, with children, with male ward, as a triage nurse. So I have witnessed a lot of things, and I don't know if I can tell up to tomorrow. Maybe I'll not finish, but I will try to choose some of the cases which really it was like um,
The, the
it
cases
did,
that touched you.
yeah, that have touched me. Yes. The most of the time where the patient was brought to the hospital, he's fully disoriented of the time, and he doesn't know where he is. Sometimes they brought him handcuffed, and he will be in a very terrible condition. So we used to tranquilize him, give him injection, and put him in the seclusion room for how many days, you know, he will stay maybe at least for 1 month without him coming back to the reality. And once the patient is khalas, and mashallah, he started and getting treatment, and you know, and realizing where he is, and he starting asking about his family. Can you imagine, Sheikh Hatim? One of the most question or patient used to ask is, "Sister, how many days did I stay here in the hospital?" And I used to say, for example, okay, you have been here for a month. And then she used to count, okay, so I have to pray all these months which I have missed, all these days which I have missed.
SubhanAllah.
Oh,
SubhanAllah.
Come on, subhanallah. I said, no, you don't have to do that. You انت مرفوع عنك الكلام يعني you don't have to do this يعني you no sister I have to do that I have to pray. And if it was
SubhanAllah.
Ramadan, they will ask you also, how many days did I, you know, I miss? Then that was itself, it was, to me, it was, I started realizing, come on, we are healthy people, and sometimes you miss salah, and sometimes you don't. I don't know, have a lot of issues that you know goes around. Maybe you know, you're not praying, but see this particular person, you know, he was out of reality. She was out of reality, and now she's asking you, how many days did I, you know, I I didn't pray,
amazing.
and she wants to compensate that prayers which she didn't pray. So that was one of the most thing which will really touch me. And I started, you know, searching what is my prayer mat, so I will pray. Because
I
really touched
think,
my emotions. Yeah,
Doctora, this is very inspirational, and it teaches
yeah,
us a lesson that no one
exactly.
has an excuse not to pray. You know,
At all.
if they can pray and they're concerned about prayer, what about
Yeah,
everybody else who have,
yes,
you know,
yes,
excuses not to pray because they're lazy
Exactly.
or they're tired or they
Exactly.
don't feel like praying? I think that's
yeah,
a very big lesson, and you have chosen the best story
yeah.
to tell us.
You know,
And thank you for sharing that story.
Thanks.
yeah, I
Yeah.
can say that she literally taught me something. Because that time I was too young, and you know, sometimes if you are too young, then you are busy with a lot of things. So she gave me a lesson of life. I can thank her up to tomorrow because she made me realize, no, you have really, you know, with whatever, how much, how you get busy in this world, you have to remember that your Creator is there. So you have to remember that you have to fulfill that you know your prayers and do whatever you're supposed to do.
How do you convince the community and parents that you know what your child or your relative is going through is an issue of mental health, and it is not the common understanding that the society have, like jinn or black magic or other supernatural issues? How do you explain to them? How do you make them understand? And do they get convinced? Because I understand that sometimes in a lot of communities they get attached so much to these beliefs that they don't listen to the professionals when it comes to mental health. So tell us a little bit about that, Dr. Hamida.
Yeah, actually, in doing that, we had a really challenging time because we have to reach community as much as we can. So we used to, for example, we used to not to target only the people who are having mental ill issues, mental health issues. We used to target everybody. So we wanted like everybody to understand what is mental health. So in order to do that, we used to go to the community. So we used to go to the health centers where people, where while people are waiting for to see their doctors, we used to take like pamphlets and we used to go there and talk to them in Arabic, and to you know we used to have like a campaigns. Okay, we go to the malls, we go to the community, we go to anywhere that we get, and you know a group of people who are together in order to you know increase awareness in mental health. So we were using that like a simple language, direct language. Okay, so we were not using really this scientific words because they will not really understand what, if you say like schizophrenia, if you say delusion, they will not understand what is delusion. So we used to use like a simple word that they can understand, and on the same time they can even ask question about it. So for example, we ask them about what do you see in your child. For example, if a child is having schizophrenia, so if the child is denying that you are his father, so is that right to you? What do you think about that? Because one of the most common symptoms in this one psychotic illnesses or schizophrenia. It's like delusions. So most of the cases used to come like they have delusions. They, they deny that this is their father, this is their father, or this is their mom, or they were hearing things, they were seeing things. So we used to tell them what do you understand? So what do you think about delusion? We didn't use the term delusion as delusion, but we used to put it in a simple language that, their belief is strange to you. So what do you think about this? So, okay, they will say, okay, yeah, yeah. For example, a father who was describing his son, and he was telling that, I started realizing that my son is not well because while I was driving with him in the car, he started saying that there is something which is implanted in their car, and that's I don't know, a camera or whatever it is really following him, and people they're tracking him. They want to kill him. The father, he believed that time because somehow he said maybe there is something, maybe he has a friends or something like that.
Yes.
Then he took the whole car to the service, to the car service, and he tell them, please, can you check inside the car and he was literally standing there while the people are doing this thing. They're checking the car. He wanted himself to make sure that there is nothing in the car. But at the beginning, he believed his son that there is something in the car. When he realizes that that there is nothing in the car, then he started thinking that there is jinn. Maybe someone has sent jinn to his son, and that's why the son is saying that there is a camera in the car. But later on, the child started even exhibiting more mental illnesses symptoms. He started denying that this is the father to him. He started saying that his father is the Khomeini. That time Khomeini was alive, I think. Yeah, that is his father is Khomeini. He's not his father. The father is trying to get closer to him, and the child was totally avoiding him. He packed his bag and he wanted to go away, following his father. Then the father started realizing, no, this is not it's not jinn. It's not, there is something wrong with the child. So when we started explaining, and this, subhanallah, when we met this particular person, he was in the health center taking his treatment, and diabetic treatment, whatever treatment. So when we started explaining to the audience that this is mental health, and this is, if someone is having mental illness, will think about, their thinking will be vague, and will be like you will not understand how they think. Immediately, this father got our attention. Then he started asking questions. So my son is doing this and this. Is this correct? We said no, it's not correct, and please bring him to the hospital. So we were using as much simple language as we can in order to reach the community, to make people understand what is mental health. And I can say at that time, most of my generation, our father were illiterate. Majority of them, they were not like educated, So we were trying to use a simple Omani, accent, or Omani, Arabic, that we could reach to the people so that they understand what it is. It took us, like, for example, 10 years in order for the people to understand or to have fully insight about mental health.
Let us take some comments from our viewers as well. We have Bilal again, our brother Bilal Afriqi. MashaAllah, sister, this is very good information, wallahi. May Allah reward you. I have worked in mental health for 21 years in the UK and now in the Caribbean. I worked within Muslim populated areas. And we also have from Ahmed Al-Matani, Love for Humanity. MashaAllah, Dr. Hamida, you are educating us about very important ideas and lessons. We have a question as well from Ahmed Al-Farsi that says, how do we differentiate between a person with mental illness and a person with spiritual touch, like magic, envy, you name it? So,
what I can say about, I can just describe about, the mental health symptoms, about the spiritual things. Some of the people, it's not necessary that they're mentally ill if they're extremely practicing their spiritual belief. But I can say that, anything that, will interrupt or will interfere your daily living in terms of thinking or your behavior or emotion is considered to be a mental health issue. Because, to describe you as a mentally healthy is the way you relate to people, the way you realize your abilities, the way you cope with the stress, the way you contribute to your community. Okay, so if there is any interruption in these things, means to say you are not mentally healthy. So of course, the people who are having, like, for example, hallucination, delusions, and all these kind of symptoms, they will not be living the normal life that anybody else is living. They will not be contributing to their community. They will not be living, مثلا, having the normal life with like anybody else is doing. They'll have problems with their social skills. They will have problems with their, the way they think, the way they handle issues, they handle stress. So anything that is out of the line in the way you behave or the way you think or the way you handle your emotions, it's considered to be a mentally issue. So about spiritual things, I cannot say much because I am not really, I'm not
But
really into that. Because,
the,
uh
Dr. Hamida, sometimes when you have a patient in the hospital and you run all the tests and they seem to be normal, but sometimes if you can't explain what is wrong with the patient, because physically and through the test he looks like a normal person and he has all the normal symptoms, but he's still not acting in a normal way. Do you refer them to further, treatment, or do you send them away, or what happens? Or have you come across such cases?
Actually, that is a very good comment or a question, because I can say, Sheikh Hatim, in psychiatric or mental health, we don't have any diagnostic machines. We don't have any blood test that will tell you this particular person is having schizophrenia. We don't have any, X-rays or, lab that will send the specimen there
No.
and they will come out that this is a positive schizophrenic case. So it's all about our own judgment. We as a profession, so for example, a doctor, a psychologist, or a nurse, it's about how is she really seeing the case, or how is she evaluating the case. So we are the source of we are the diagnostic machines that that when we see the patient, or when we'll be able to recognize that this is a purely mentally ill patient, or how severe is the symptoms. So it's about our judgment and the way we see the patient. So a lot of patients, they'll come to us after they have been to many hospitals. They went through a lot of investigation, blood investigation. Physically, they're not, they don't have anything. But it's about here. It's about the mind. It's about how they think, how they, relate to people. It's about, how they handle their emotions. So this is where there will be a problem. So, and those things cannot be seen in any X-ray. So it's about how you judge. So most of the time we have a set of, for example, we have something called mental status examination. And that mental status examination, we have everything into that form. So we see it, the way the thinking, the thought, the memory, and the way you appear, and the way you relate to people. So all these set of questions will be able to tell us that where you are in terms of your mental status. Okay, but if we talk about machines, we don't have anything that any
Yeah.
diagnostic machine that will tell you this is a purely schizophrenic patient.
But with your experience,
Yeah,
will you are you also able to know that without using any machines, just
yeah, yes,
by looking at the
yeah.
person?
Even doctors, even psychiatrists themselves, they don't use any machine. So it's about their judgment and the way
Yes.
the patient come and exhibit the symptoms that he has. So we have, like, for example, criteria. For example, schizophrenia, we have criteria like the patient have to have this set of symptoms for 6 months. So in terms for the doctor to diagnose him as a schizophrenic patient, he has to exhibit these symptoms within this period, non-stop. For example, 6 months he's having delusions, or 6 months he's having hallucinations. So at the end of the doctor will evaluate since when this patient is suffering from this. From that judgment, then they'll be able to say that, okay, this is a manic case, and this is a depressive case, or this is a schizophrenic case. So we have a set of criteria that we follow, and we see if the patient is exhibiting those symptoms, then will be diagnosed as a certain disease.
Dr. Hamida, recently a lot of students, especially the ones that are sent abroad, they suffer from depression.
Yeah,
And there are few cases where depression leads to committing suicide.
yeah.
What is the main cause for students to be affected with depression?
I think, in my opinion, the cultural culture shock. So when they go, some, for example, they finish the secondary school, they're just 18 years, then they will be
Mhm.
sent abroad somewhere where they were never been before. For example, especially people like we know our tradition here in Oman. So we have like big families, extended families. We live with our cousins, we live with our brothers. All the time we have like all the gatherings. So when they go there, they find themselves alone. Okay, and sometimes because of the language barrier, because of maybe difficulty of the studies, they are not seeing their parents for a long time. So all these things will trigger depression. And I can say that um, majority of students, when they start to study, they have certain expectations, so they want like to meet that expectations. So when they started failing that, meeting that their expectation, because they want their parents, for example, to be proud of them, then later
Yes,
on they feel that they are not doing well in school, especially in the first year. It will be very difficult for them. First of all, they have that, they feel sad because they're alone. They have, they are missing their parents, they are missing their friends, they are missing a lot of things, and to handle the first year is really a challenging to all the students, because after that maybe you get used to the place, you get used to the people, you get used to the studies, and when you are doing well, you're okay. But when you are starting failing the subjects and going back and you're not doing well, here maybe they are not even telling their parents that they are not doing well in the school. They can see only the parents, they know that their children, they are in the school, they're doing well. And all these things, when they pile up, then later on, it's it triggers depression, definitely. And majority of the students, even in here in Oman, sadly to say that suicide was one of the things which we never had among Omanis. But recently, many have committed suicide among students. Is it? So what is the reason behind that? Is again about meeting the expectation. They are not really, they are not, uh, they don't handle the issue when it's at an early stage. So they wait
yes.
until everything is piled up, piled up, piled up, and they're not talking to anyone. And I'm sorry to say, sometimes we have counselors in the schools and all, but even the student, they will not even approach the counselors to go and seek help. Again, they consider that it would be a stigma to them, or maybe this counselor would come to know what is wrong with them. They don't approach the counselor, so they will end up, having that severe depression. Absent in the school, and they don't handle their projects, they don't handle their exams, and sometimes they even, I have heard that some of the students, they will be even, terminated from the school, but they will remain to be in the campus or near to the campus. They will not even tell their parents. So sometimes, that are the things which will trigger depression. Majority of them, maybe they cannot go back to you know, for example, if she was a doctor or she was studying medicine and she was not doing well, she doesn't see herself below that. So what would be the next choice? The next choice is like, okay, let me just finish my life. I will not handle this anymore. But I have heard that here in Oman, they put like a hotline for suicide. If anybody is having suicidal ideation, they can call and seek help. I don't know how far we have reached in that this one. I'm not sure
How
about the
practical is
yes.
that? Because a person who wants to commit suicide, would he actually call?
If he is at the beginning, having that sadness before having the suicidal thoughts. When he started becoming depressed, if he found himself that he can go somewhere or he can find someone who will help them, definitely it can help. But when they start to become like suicidal and having suicidal thoughts and all these things, it is difficult. That's a good question. Sometimes they will not stay, so they
Yeah.
will pursue their plan, or they will go on, or they will think how to really to do it here. But this helpline could help the people who have try to attempt suicide. Okay, so maybe if they will refer to them, or مثلا they will know that there is a place that they could seek help. Maybe they will think of calling those numbers.
Yeah. Okay, Dr. Hamida and maybe Hatim as well. If you can give advice to parents and students, what would that be to stop this from happening? And I'm talking about both the
Dr.
students, the doctors.
Yeah.
I'm talking about
Doc-
both the parents and the students.
Dr. Hamida will
Okay.
give the advice. She's the specialist.
I hope so. I hope really I can reach that advice. I think communication is the most important thing. Uh, from the parent side, I think they should give the choice to their kids to see where are their potential, because sometimes we find that the children are just taking their specialty or choosing any like
Major or something.
yeah, majors, or according to their parents this one parents
Choice.
needs or whatever it is. Yeah, choice. Okay, so I think maybe the parents should be very open to their kids, try to understand that it's not everything that the parents, of course, we as the parents, we need to see our children, and that they have the best that they can. But we have also to understand that this is not always true, because some of the children, they have capabilities, they have their own potentials. Okay, so give them the choice to choose what they want. Okay, you can discuss with them, you can guide them, you can give them advice, but don't force them to do something that they don't want to do. And I think talking to their kids in a daily basis about what is happening with them in their school, okay, that would really help so much. Because sometimes when we get busy with our thing, we know that okay, khalas, she's already an adult, she can take care of herself. We don't need to talk to her. She knows her way. No, she doesn't know her way. Maybe she has challenges. Okay. You as a mother, sit with your daughter and try to understand her. I will give you example of myself. I used to see my daughter like, uh, she's not as clever as I think. But when did I discover that? When I went to Scotland with her. When I went to Scotland with her, she was in the class 12. Class 12 means the secondary. So we went there. That
ثانوية.
yeah, we were.
ثانوية يعني.
Thanawiya, yeah. So we went there. So our plan was thinking that okay, she will finish Thanawiya there, and she will be able to join the college there. But when we went to Scotland, we went late, and the Omani government, they told us that she has to take certain majors in Scottish school in order to be recognized here as a Thanawiya Amma. When we went to her school, when I went to her school and asked her about that, they told me no, it's too late. She cannot take these majors because we came 2 months late. So we started wondering what to do. So is she going to really to lose this year? Then there was only one choice, that she has to join Arabic Thanawiya. And luckily we found that Libyan government, they are providing Arabic classes, and they give Thanawiya. And one of my friends told me that her daughter, she took Thanawiya Libya, and she was able to join university here in Oman. So my daughter told me that, Mama, I will not leave the Scottish school, but I will be going to Arabic school. And my daughter was one of the girls which was going to private school, and she never had sciences in Arabic. So what happened is that Libyan school was only teaching Arabic, all the sciences in Arabic. So imagine someone who never studied sciences in Arabic, and she's just joining in Thanawiya only to study sciences in Arabic. So that
It's
was really
challenging.
challenging. Yeah, I started thinking she will not make it at all. But I don't know. That was the time that I realized that I didn't understand my daughter all these years as a mom. I started blaming myself. And Alhamdulillah, luckily she made it, and she passed the Thanawiya, and she continued going to the Scottish school because she wanted to learn something from them. She really liked the system there. She liked the teachers there, because she's good in arts, and she was doing a lot of things in school. So she studied both Thanawiyas in English and Arabic.
MashaAllah.
ما شاء الله. ما شاء الله.
Okay.
Alhamdulillah. So that was one of the example. Me as a mom, how did and I started even blaming myself. All these years I didn't understand my daughter, and that is my only daughter. So
SubhanAllah.
what I'm saying to the parents, try to understand your kids. They will have a lot of potential. They have a lot of things that they can show you. Don't pressurize them. Don't show them, just, guide them, facilitate what they want, and let them bring out what they can. And you will be really
True.
amazed with their potential.
Very
So
true.
that,
Very
and
true.
I'm telling the student also, don't keep quiet with
Mm,
whatever issue that you are going through. Take anyone, not necessarily your mom. Take anyone whom you feel comfortable to talk with
mm-hmm.
and talk. There is nothing more than communication or talking when you want to get rid of any mental stress or something like that, because you don't want these things to pile up and you end up in the suicide.
Uh,
SubhanAllah.
we will take some comments from our guests, but also I think I'll do some kind of a commercial for Hatim. If you need mental help apart from Dr. Hamida, I think you can also call Hatim.
Ali,
Ah,
Ali, I'll,
yeah.
I'll start charging you now.
Ali, as I said, I know Hatim before you, so I know that he can do that very well.
No. You knew him only
Uh,
10 years ago. Mine goes back what 30 years,
But
Hatim?
me and Ali, we know each other, I think, more than 30 years.
no,
Yani,
he was hiding you from
since
us. I don't
school.
know why. So I don't know why,
Since,
Ali.
since
So I didn't
school.
know
I,
that.
I, I always like to work behind the scene.
Okay, okay.
Alhamdulillah.
So let
So,
us just take some comments before we ask
yes.
you the main question by Hatim, inshallah. I've noticed some teenagers aren't educated in how to deal with their emotions when transitioning to college life. I wonder if there is a plan to introduce a class about handling emotions in school. So that was actually a request from
That
Ahmed.
that that Minister of Education will answer to that question.
You got the answer, Ahmed. And we got from Salima Al-Harthi, wonderful work to help others with kindness, heart. God bless you and your family. Wish you all the best. And we also have, we got a few comments in here as well. Okay, again from Salima. Hope all population to understand that Ibn Sina Hospital and how to treat patients in general. And now it's what's the name of the hospital now? Al Masarrat, right? Not
Al
Ibn
Masarat,
Sina.
yeah.
Masarra.
Masarrat,
Yeah.
Masarrat, not Ibn
Yeah.
Sina anymore. We got Ahmed Al Farsi saying appreciate you for this wonderful topic. Okay, Azza Al Toqi say well said Dr. Hamida, mashallah. And we got a few more questions. Just a second. Okay. Okay. There's Ahmed again. He wants advice. Please give advice to some counselors who might share students' private stories. Okay, I think
Does he mean school counselors or
I believe it's
hospital
about school
counselors or
counselors.
anything? I think it's very rare that counselors share stories, especially in details with names and things like that. I believe always in sharing stories uh, anonymously, so people can benefit and learn from them. But of
I think.
course,
Yeah, I think
you always save the confidentiality of the patient. You don't mention
exactly
his name, you don't mention details, but
very
for learning
important.
purpose, it's important to share stories.
I think the Hajid show says something similar to that. Uh, should either stop doing that or quit the job, because if counselors that doesn't know how to keep clients secrets, they are not fit for the job. Yes, that is true. That is true. Hatim, I think before we move to your question, I would like Dr. Hamida to tell us the story that she told me the other day on the phone about
I
a
wasn't there.
girl.
Okay.
I wasn't there, so I don't know what story.
Yeah.
But, talking about that, I think I want to talk about a little bit about my research, and which was the main thing that I felt that I am so honored to be in this channel, and I wanted some little bit time to talk about my research actually. And my research is about drug addiction in Oman, and I have conducted the research in a central prison in Oman, and that was looking about exploring the relationship between life experiences of drug abuse, both in prison and outside prison, and the contributing factors that are leading this kind of drug addicts or this category of people to go back to drugs within the very short time after release. And طبعا the story which I have told Ali is among one of the I don't want to call patient, but I can say that it's a victim. She's a victim of addiction. Okay, so my study actually was looking at the young Omanis who have been in prison and have been released in the prison, and they went back to prison within a very short time. So we know that here in Oman, drug addiction is, sorry, I can say that it is out of control. Every day there are new cases. Every day we hear people in jail. Every day we hear people who are dying because of drug overdose. So it became, to my definition again, I call it as a pandemic. It's there in every house, literally. Poor, rich, educated, not educated, sheikh, not sheikh. Everybody now is complaining about drug addiction. And the saddest thing that we nowadays we started seeing even female female patients are becoming a drug addict, which was like very, very, very rare. And in our custom in Oman and the tradition in Oman, the way we protect the lady and the family, how they protected their girls and their it's something which I can say it's scary, because the story which I have told Ali is about a girl who is really happened to be a victim of drug abuse, and during the pandemic, during the lockdown, during Eid, a mother of this girl called me that her daughter is out of control, and that time it was totally locked down, and she didn't know what to do. She didn't know where to take her daughter. Actually, she called me previously, and I guided her to take her to the hospital. And the girl went to the hospital, but she signed against medical advice, and she was, she went back home. So during this time, the girl became out of control, and she was like going out of the house. She became a source of abuse. Definitely it will be sexual abuse, because she was searching for money to buy drugs. And the mother called me. She was literally crying. She didn't know what to do. And I told her, please, because the symptoms which she told me, it was totally showing that she's having also mental health issues. So I advised the mother to restrain the girl, because she was going out of the house, and she stayed like 4 5 hours without. The mother didn't know where she went, and I think it was the late night when someone just came and dropped her at home. Then they were able to restrain the girl, and they took her to the hospital. Uh, Surprisingly, that the hospital, they didn't receive the girl. They said that last time she signed without medical advice or the protocol of the hospital, she should be admitted after 6 months. But the condition, how the girl was, she was literally out of her mind. She needed someone to protect her. The mother is alone. She's divorced. She's having other children. She couldn't control the girl at home. I think this girl the hospital should have kept her, at least for the purpose of protecting her from whatever was going on with her. But I was surprised that the girl was returned back. And the mother is telling, the way we took her, restrained her, and the way we put her in the car by force, and we took her to the hospital, with that all that effort that we did, and they turned us back. They didn't receive the patient. So they told her that you have to come during the working day. So that was like Thursday, I think, and the working day was like Sunday.
Sunday.
This, yeah. So the second day also, they put the girl in the room. They try to close the door, because, the mother is saying, I don't know, I cannot really control this situation, because once I open the door, she runs out of the house. And if I tell you the story of this girl, you'll be surprised, because she's an educated girl. She was having an abusive marriage before this marriage, and it happened that she married a drug addict, and this man is the one who really pulled her leg into this condition. And after he died, I called the mother to find out what happened. Then it seemed that they took the girl to the hospital with a lot of wasta, I can say, not the protocol again. They put the girl in the hospital.
Sad.
The same scenario happened again. The girl signed against a medical advice. So the mother is telling, I was at home just one day. I was at home thinking that my daughter is in the hospital, and I could hear someone is knocking the door. When she went to open, the girl is in the door. So they released the girl again, without even her parents knowing that they are going to discharge the patient. So that was something which really, I thought even I'm going to talk to the hospital management if, they have really to do something about that. Come on,
Doctor,
yani,
I just wanted to ask you, if this
mhm.
girl is mentally unstable, how can she sign a document?
No,
Why
they
do
put her
why,
in drag unit. They put her in drag unit.
but
So
how what the document says? What does it do, this document, if she signs?
the document is related to all the drug addiction, only the drug addiction patient. So they have the protocol in the drug unit that anyone who comes to the hospital and he signed out against medical advice, he will not be admitted until 6 months. If he finishes 6 months, then he can come. He will be eligible for admission.
Ah,
So
okay.
that is the protocol for drug addiction patient, because to them that the drug addiction are very manipulative, and they can just sometimes when they run out of the police, then they come to the hospital, they stay one day, when the case is finished, they go back home. So I think that was the reason why they have applied that rule. But in her condition, it was different. She was a girl. She needed someone to protect her. Okay,
Yeah.
she needed to, and the way the mother is telling, she's totally out of her mind. It's not only drugs, because she was like having hallucinations, she was seeing things, and she was like screaming. Even she was, sorry to say, she was pooping in her dress. So that was something that she really needed a medical attention. And I was surprised to see that they just released her and let her go home.
This is really
This,
sad.
this
I think it has to change, and I think if anybody is hearing from that side, you have to change. You have to accept that there should be exceptions. Okay, it's good to have rules based on whatever experience you've gone through, but that shouldn't apply to everybody. You have to analyze the
Yeah,
person.
yeah. So if I go back again to my research, my
Yeah.
research was looking at the people who have been like the drug addicts. Only those who are using drugs. Sorry, not they're not involved in any other crimes. So, and those who have been like having multiple re-entry in the prison, and I think Oman, they wanted to control drug addiction, and so they applied a very strict penalties for those who will be caught, and they will be re-jailed again. So in order to do that, they like the punishment was so strict. But the amazing thing is that the number of drug the addicts who are going back to prison were even more than before. Okay, so you find that someone is out of jail 6 months, 2 months, 3 months, again they're in the jail. So they wanted to control that. That they found, but unfortunately they found that there are many people who are going back to prison even after that strict rule. So my study was to investigating what are the contributing factors which are letting this category of people going back to jail, or sorry, going back to drugs, regardless of knowing that there will be the rules of, or the penalties will be stricter than before. So I started investigating, and I studied the life experiences in the jail. So what is happening when a drug addict is in the jail? And what is happening when the drug addict is out of the jail? And what are the contributing factors that are letting them to go back to drugs and go to the jail? So the finding of my study, it was like the life, it was, divided in 4 dimensions. One dimension was looking at the life experiences in jail. And the second dimension is when they come out and they go and face their families and their community. So what is happening? Then the third dimension was looking at the impact of prison on these people. And the fourth dimension was about contributing factors to early relapse. So what I can say about my findings. So the first dimension, I really learned a lot of things which is happening in the jail. So they think that way if they put a drug addict in, sorry to say I mean whatever it is applied in Oman or the government. So they think that if they put a drug addict in jail, he will be like he will stop using drugs or he will stop like doing whatever he does. But
Mm.
unfortunately to say that they are even teaching him to become a better addict when he's in the jail, because based
Yeah.
on the findings which I found, that in the jail itself they have a lot of things that they are facing, and they are changing their identity completely. So you put an addict in the jail. He was having a one problem, which was it was addiction, but when he comes out of the jail, he will be having another problem. So rather than dealing with one problem, which was addiction after release, they will be dealing with addiction plus they will have either physical or mental illnesses or issues. So he comes out of the jail, and he is a completely different person. So in the jail, what happens when they go in the jail? So they described to me that when we go to the jail at the they suffer for something called entry shock. So regardless of how many times they have been in the jail, all of the prisoners, they suffer for something which is called entry shock. First of all, when these people are caught and kept in the jail, they will stop of course there will be they will be caught because they're using drugs. So maybe the person was using drugs 2 days before or 3 days before. So when he is placed in the jail, he has stopped drugs abruptly. So when he goes in the jail during the first week, what is happening? First of all, he lives in denial. Then he started getting withdrawal symptoms, and he will be like, of course, Taban, they will not take him to the clinic immediately because he's having withdrawal symptoms. He will be suffering with the physical symptoms and the psychological symptoms of withdrawal because he has stopped abruptly. So they don't like, sorry to say, they don't look at the people who are using drugs, what happened to them if we put them in the jail or during the first week or second week. Definitely majority of them will be suffering from withdrawal symptoms. And those withdrawal symptoms are a group of symptoms, physical symptoms, which is really annoying. They'll be having pain, joint pain, they'll be vomiting, they'll be having headaches. So what the maximum that the prison will provide them is just maybe analgesic, which is maybe Panadol or something like that. So they suffer from entry shock. The majority of them, they say, when we go to the jail, we suffer from something called this amnesia, which is loss of memory. And most of the time, it is like short-term memory. They forget everything about their short memory. Majority of them, they say, we live in a fantasy. We don't want to, they live in denial that they're in the jail. So they started, fantasizing their whole life. They started hearing voices. They started, until they adjust, it takes them time. And the adjustment itself, it's a totally different story because each individual is different, and the way they handle the adjustment is totally different. Some of them they adjust with the jail life, maybe 1 week, 2 weeks, and they're okay. But some of them they stayed until they come out. They still did not adjust in jail. Another thing which I found that the life in jail is, they create a network, exactly the same network of what they have outside. So they put all drug addicts together. So the dealers are there, the consumers are there, and they have, sorry to say, the drug deals sometimes happen even inside the jail. Okay, so the same network which is outside, it will be even inside the jail. Okay, so that is another thing which this one they suffer. Another thing is like the third thing is like boredom. Boredom nowadays because of human rights. Okay, no any prison is forced to do any activities. They can do whatever they want, and if they don't want to do, they just stay in their wings. So that has brought a very negative impact on them because most of the time they are sitting, okay, either fighting or all the noises or staying in one small place, a big number of people. Okay, so they started creating that criminal mind, and they become disturbed. They become physical and emotional. They cannot really handle that particular thing. If they try to go and طبعا the central jail here in Oman, mashallah, it's a very big institution. It has a lot of things, a lot of recreational activities. But some of the prisoners, they choose not to go to participate because it's optional. So when they go to participate, some of their colleagues or their people there, they start doubting that they're working with the police. So they will be what will happen? They will put themselves at risk. So what they will choose, they will choose not to go. Okay, so most of the time they complain about boredom. Another thing which is in the life, this one in prison life, this the gangs and the groupings, it's the same as if they're outside. So all drug addicts, they intend to be one group. In that one big group, there is small groups, there is small community. So there are leaders, there are followers, there are someone who needs to be disciplined. They can 5 or 6, they can even beat someone
We
who
have that
were not
here.
like yeah,
Yeah.
yeah, yeah.
Wow.
I'm talking about Central Jail in Somalia. Okay,
I
so
thought this only happens.
no,
Yeah.
no. Believe me, prison is prison wherever it is in the world. It's the same mentality, same everything. Yeah.
Wow.
Okay. The last thing, which is in the life of drug addicts in prison, is about getting the disease. Prison itself
Yeah.
could be a cubic of communicable and non-communicable disease. So majority of them, they come out with the chest infection, with of course they'll get AIDS. You know what I mean about the
Yeah.
relationship and all.
Yes.
And hepatitis is very common, especially with drug addicts. Even before they go to jail, majority of them, they already have the hepatitis, or the hepatitis B or C or something like that. So they come out, if they come out of the jail. Apart from their addiction, they have already this communicable, non-communicable disease. So these are the, if I have to describe the life of an addict in prison, it's this is the way it is.
Subhan.
So there is no way that you can say that you're putting someone there to stop drug or to quit drug, because whatever they learn in prison about drug is even greater from whatever they learn here outside the prison. Because everybody is there, everything is available, and
But
they can hear, they
but
can learn from each other.
but Dr. Hamida, let me interrupt you a little bit. When it
Yeah.
comes to drugs,
Mm-hmm.
there are two types. Someone who is consuming drugs, he might be a
Yeah.
civilian,
Yeah.
and someone who is a criminal, who is dealing in drugs, who is smuggling, who is stealing. So these are two different things. Now,
Mm-hmm.
if we don't put them in prison, what should be the right place for them to be for both two different segments of drug addicts?
Yeah. To me, the one who was smuggling drugs, I don't even want to talk about them because they deserve jail. Because these are the people
Yeah.
who are hurting other people. These are the people who are killing, and not even hurting, they're killing other people. Okay, so you
Yes.
cannot really compare and put them in one category because they are not at all
Yeah.
in one category. And surprisingly, I can tell you, Sheikh Hatim, this kind of, the smugglers, most of the time, they are not addicts. They don't use drugs. So they sell drugs, but they don't use, majority of
They
them, they
don't
don't
use.
use drugs. Yeah.
Yeah.
Okay. So they are very smart to protect themselves. Okay. So we cannot put them at the same categories of those who are using drugs. What I'm advocating those who are using drugs without even in being involving in any other crime. Because, again, we can say that, maybe drug addiction can teach them to do a lot of crimes in order to fulfill their needs and to get drugs. So what I'm
Yes.
advocating, and that is the majority of prisoners which I have met in prison, they have just been in jail because they were just using drugs, even, or they maybe the possession was for their own consumption, not even for like for selling. So I
Yes.
can advocate only those who are using drugs, and they're helpless. These people, they want people to help them. We cannot put all the blame on these people because in the first place, they will not be addicts if they're not having personality issues, if they don't have like, there are people who are like, they
And
fall in
maybe
this trap.
they're victims. Maybe they're
They're
victims.
victims. Majorities
Yeah.
of
Yeah.
them are victims. They will tell you that they have started, that teenager period when they started exploring and trying everything. They didn't know even the consequences of this. So why to blame them? Okay, so we cannot really put the blame on them. What we can do is to help them come out of this pandemic, what I call in my definition. Okay, so if I have to talk about the second dimension of my findings, it was when they come out of the prison. So they come out of the prison, they go to their parents. The parents, oh, my son have been corrected, and as the participants called, they said, they considered us as Sharif Makkah. Oh, he's good now. He has been disciplined, and he's okay now. He's ready to come. They don't know that the person whom they sent in the first place is totally different from whom they are seeing now. Okay, so he
The
comes.
first thing the first thing they do, they give him a wife.
There you are, exactly. It's not only a wife. During the first week when they come out of jail, all the aunties and the cousins and معرف ويش كل حد, everybody will be bombarding him with the advices. See, now you're okay, you are good, you can do this, you can. No one is even bothering to ask him, how do you feel? How are you? How like
Yeah.
you? Because they see him like khalas, he has been brand new, he has been corrected, serviced and brainwashed. Now there is no
he's a
drug.
newborn.
Yeah, he's a newborn. Yeah,
Oh,
actually the opposite of that. Okay,
Mm.
so after 1 week exactly from their release, they started. After 1 week from their release, then once everybody goes back to mind their own business, what will happen? There will be an emptiness. They don't know what to do. Okay, so khalas, the father is busy, everybody is busy. Okay, they left alone. So expecting him that he can do magic. Okay, go find job, go find this, go find that. Then after 1 month exactly, when the father realized that okay, he's not really going to work or he's not finding job, everybody will start turning against him. Okay, blaming him. Okay, then family issues will start. Stigmatizing themselves. The father cannot go to the
mashallah.
community. They cannot go approaching people. Will stop coming to their house. Father
Mhm.
and mother fighting because the mother is sympathizing with their child. The father is too strict with their. It's a chaos. Okay, but what I can say, it's again, it's mismanagement and drug addict. It's a burden. It's something that has come to your life. We have to embrace that and to understand it's not because of their fault. Is us how to learn how really can we embrace our kids, accept it as it is a challenge to you as a parent rather than putting a blame on him. Okay, so in terms of family taban, there are a lot of things which I have found. I cannot describe it all here. Okay, so when they go to the community is rejecting them. When they go to find job, they have blacklisted because they have been in jail for 2 years. They have to be like free,
Subhanallah.
Yeah.
for this one. They cannot find job. They cannot find Alhamdulillah, here in Oman, we don't have something like homeless. When they come out of jail, there is someone will take them, either parents or family or mother. They'll be having somewhere to go. But outside there, according to literature, majority maybe will be homeless. But here, alhamdulillah.
Yeah.
But what are we doing really when we receive our loved ones once they come of jail? It's our responsibility.
Mhm.
Okay, so the third dimension was talking about the impact of jail on them. So what had happened? What does the jail happen did to them? So you will find them that they have become sick, physically sick, psychological sick. They have lost their identity. They become like they develop aggression behavior. They cannot relate to others. They cannot handle daily life. Okay, they were not prepared to come out and live the stress of the new life which they have. Okay, so the fourth dimension was talking about what are the contributing factors which are letting them to go back to drugs. That again, I found a lot of things. I can just summarize in two things. One of it is about how legal system is dealing with them here in Oman. I can say that majority of drug addicts, when they come out of jail, they will assign a cover detector. Okay, so detector will be
Mm.
following them everywhere. So, and all of them, they know about it. Okay, so you find that the drug addict, when he comes there, the most thing that they will be fearing is about the detector who are following them.
Yeah.
Okay, rather than signing a detector, signing a counselor, signing to them a
Yeah.
counselor or social worker who will help them to
Yeah.
find job or
Exactly.
yeah. Rather than putting the pressure and making these people living in hell. They're really living in hell. We think that they say he has been out of jail, but within 2 months he have gone back
You're adding
to
you're
drugs.
adding more
What?
more burden to him.
yeah, what are the reasons which have led this young man to go back in jail? So the thing which I want to mention here is that once you put a drug addict in jail, he will never come out of that circle. It will be life jail, life, outside, inside, outside, inside. So the same circle. And the most of the time that he live, it will be outside, it will be inside the jail because he lived
Yeah.
there 3 years. He comes out 6 months. He go back 2 years. He comes back. This will be the circle,
So
and
question
the more
on the
damage will come. Mhm.
on the same topic as a question by Ahmed. He said, "I wonder if you're sharing these scary findings with the officials. If yes, how was the response?"
I have just graduated from my PhD, and I have actually met one of the I can say authoritative, person. Um, and he promised me that we'll be talking after that, and he and I we did not really start and talk much about it, but he promised me that once I am done with he was going on leave, and he said I was going also for my graduation, which and I told him once I come back, then we can talk about it. But I started disseminating the findings. I conducted this one presentation in Al Masara Hospital, where most of the doctors were there, and they heard me. And I also put in the newspaper so that the community knows that this is what is happening. So my recommendations were actually again divided into long-term and short-term recommendation. The first recommendation that I would like, if you are really putting people in jail, especially the drug addicts, there should be a rehabilitation center in the jail that will rehabilitate these people, will prepare them to go when they go out of jail, what to do. Okay, and the second thing is they have in most of the literature and with the finding which I found, and the majority of the European countries, they have applied something called drug treatment in prison. So there is a center of drug treatment inside the prison. Okay, there is no harm if you want to put them in jail, but provide to them something that which will be helpful. Okay,
Yeah.
put centers which like, for example, things which will teach them something to work on, hands-on. Let them, discover their potential
like a
while they're in
skill,
the jail.
like a skill.
Yeah, like a skill. Yes,
Yeah.
I met one of the prisoners, and I was so impressed about that. He have discovered that he can draw very well,
Mashallah.
very well, and he did not know that he has that potential while he was not. He was at home. So he discovers his potential there in the jail. So why can't we really develop this their skills and help them bring out their potentials, okay, and see where they go. So for example, if he have learned something in the jail, he have the, for example, mehna or whatever it is, a profession. So there should be a system that is helping him when he goes out of the jail, whom to approach in order to continue whatever he have learned, or who or what kind of work he can do outside the jail. Okay, give them something to work on. Don't make it optional, make it compulsory, so everybody will be forced to go and do. Because if you leave anything compulsory, especially optional, especially in prison, no one is going to work or no one is going to do anything. Okay,
That's right.
so yeah, that was the short term this one recommendation. The long term recommendation is that we should have like a network, or sorry, a system that is where the Ministry of Social Development is involved, where the police is involved, where the Ministry of Labor is involved. Okay, Ministry of Health also. So there should be a system that the drug addict knows that if I want a job, I know where to go, or where can I seek help? Who are the people who could help me? If I want a counselor, I know where to go. If I want مثلا any kind of treatment. I can say we have this new hospital, which is Al Masara Hospital, but how many beds do we have? We have only 50 beds for drug addicts, 25 for rehabilitation, and 25 for detox. So compared to the number of drug addicts which are available here in Oman, and those who have registered, there are a lot of drug addicts who are not registered. I think by now maybe we have 20,000, which is not reflecting the real number of drug addicts in Oman. So I think we should have really a system where we make the drug addicts themselves approach the system rather than terrifying them with the people who are hunting them, just leaving them to face their own challenges. These are people who are really helpless. We should help them. Another thing is that they should be like a little bit like incentive when they come out of jail, because majority of them, they said, we come out of jail, even we are not entitled to go to ask for rather than benefits or something that would help them to start their life. Some of them, they have even families. The families, maybe the family of a drug addict who have been in prison, will be supported by the government only for maybe for 6 months. Then after 6 months, they will even stop helping the family of addicts. So, thinking that an addict who have been in prison will, by that time, he'll find a job. Come on, where is he going to find a job if he's in blacklisted? He's
Yeah.
not going to. No one will be
Nobody's going
accepting
to.
him. Yeah. So
Ah,
let us not to put the blame to the drug addicts only. Let us do our job first. I know that the government has done a lot. They have and there are a lot of sponsorship which people have really contributed. They are building the halfway houses, but if we don't really go to their level and understand from their perspective, what can we do to help you? Get them involved in their own decision of quitting the drugs and making them to become better individuals in the community. We are not doing anything. Even if we build a lot of buildings, fancy buildings, and putting them there with our condition. But once they come out, so what is there? So what is next? So we should be thinking about what is next about this category of people. We should not just letting them, swim in the ocean. Some of them, majority of them, they are dying because of drug so because of drug overdose. Just recently, 2 days back, one guy died because of drug overdose. How many have died because of drug overdose? And I can say the might of mental health is still even with a drug overdose. If anyone dies with drug overdose, even people are not even attending their funeral. They think, oh, he deserved to die because he was the drug addict. No, he doesn't deserve that. The family doesn't deserve to be stigmatized because he was having a drug addict kid. No, no one deserves that. So I think really we should really work hard. We should even investigate. Sorry to say, even people who are dying because of drug overdose, even sometimes it's not necessary that they have injected themselves. Maybe it is a murderer. Maybe someone have killed him. Sometimes they kill, among the dealers and all, someone, if he's not complying with them, they may kill him. But because the family is afraid to be stigmatized, what will happen? They'll just take their son and bury him. No, there should be an investigation. They should get their full right as any individual. Why you have to put all the load on drug addicts? No, it's not. Then it's not their fault to become a drug addict. It happened that their destiny became like that, but that is not their fault. Like if a cancer patient, is not her fault or his fault to become a cancer patient, and his destiny is to die.
yes.
It's the same thing with a drug addict. So we should really keep, all of us, unite in order to help our drug addict members. And that's all what I
Dr.
can say about my study.
Dr. Hamida, thank you very much for your insight. I would say that this is one of the sessions that we really benefited. It was very touchy. It's a very sensitive topic. And one of the things that really touched me that you didn't only go and get educated in this area, but you
Yes.
also concerned now that you came back, you want to solve the problem. Yeah, and people
Yes,
like you are the ones who are going to solve the problem because it takes
Inshallah.
initiatives of people who are brave, who believe in what they do to change the reality of their society. So
yes.
I wish you all the best, Dr. Hamida, and we support you all the way. And we hope one day we will see you successful in solving the problems of drug addiction in Oman and to introduce modern ways to resolve these issues. بإذن الله تعالى. جزاك الله
Inshallah.
Inshallah.
خير
Inshallah.
دكتور حميدة.
Shukran كثير. I would like to thank you,
الله
both of
يسلمك.
you and the audience and all those who have put comments. And I hope that I have reached the information to you all. Yeah.
I
And
think
the
بإذن
last
الله.
thing that I can say, please, I want to say this, and my
mhm.
thesis actually, and my hard work and my all the difficulties which I have spent. 4 years to do doing my PhD. This thesis and this hard work is dedicated to all young Omanis who are victims of drug addiction and those who have died because of drug overdose.
Alhamdulillah, Alhamdulillah. I think as brother Hatim mentioned, inshallah your study will not go in vain, and I think this is how we should always be. Whenever we study something, is how you apply it there, how you can help the community. And mashallah, you're doing a very great job. And inshallah, I hope this message gets received by the officials and I don't know, wherever it can go, and changes should happen
Inshallah, I hope so.
Inshallah, maybe not immediately, but it might take time, but inshallah, one step at a time, and it will happen, inshallah.
May Allah put this effort in your reward as Sadaqah Jariyah, inshallah, and you find this reward in the hereafter, bi'idhnillah ta'ala. Thank you very much, Dr. Hamida. Please take care of yourself, and if you ever need anything from me and Ali, we're here to support you, bi'idhnillah ta'ala.
Thank you. ما تقصروا مشكورين. جزاكم الله ألف خير إن شاء الله.
الله يحفظك. جزاك الله خير.
أحسنتم. MashaAllah. See, Hatim, now, I love this show more and more and more because of, what we are trying to do and how we're trying to help community.
Yes, I think it's very important people to have passion in what they do and to support their community and society. And it's not about the piece of paper that you get as a qualification. It's what you do with it that really matters. And today, Dr. Hamida has, demonstrated how someone can be so passionate and so concerning and so loving to her community that she would go beyond the means to make a difference. And today, honestly speaking, it was very educational for me. A lot of the things that she has mentioned, I did not know. And I'm sure it's going to help me in the work I do also for my society. May Allah reward her and reward everyone out there who is doing a wonderful job.
Ameen, Ameen, Ya Rabbil Alameen. I would like to even thank our viewers who have asked very wonderful questions and comments, and hopefully that will also not go in vain, inshallah. So thanks for your participation, and your participation will not be enough if you do not. Hatim, want to say that?
Share, like, and subscribe, and hit the indication button.
Yes.
Did I get it right?
Yes, man, you got it right this time. So, yeah. And with that, I think this is the end of the show, inshallah. So, Assalamu alaikum.
Assalamu alaikum. Hayyak.
Alaikum salam.